Hello, my name is Anya Nevin. I'm a senior occupational therapist on the integrated care team for older people. My role on the team is to complete functional assessments in the client's own home. I look at how they're managing their day-to-day tasks, and together we problem solve to make them safer and more independent at home. I do this by providing alternative ways to complete a task or providing equipment to make a task easier. I'm involved in falls prevention. I complete environmental assessments, identifying falls hazards and problem solving to make the environment safer. I'm also involved in housing adaptations. I work with people who have memory problems. I complete assessments, but more importantly, I listen to how their memory problems is affecting their day-to-day life. Together with the client, we problem solve to come up with practical strategies to make life better. I recently worked with a client. She had been discharged from hospital following a fall and she had an underlying UTI. I saw her when she came home and I gave some falls prevention advice. We discussed her goals and the main thing she wanted was to get back cooking her meals. I completed a kitchen assessment and we discussed and practiced strategies to make her safer in the kitchen. I then arranged for the therapy assistant Maggie to visit for kitchen practice. At the end of the few weeks, she was back making her own meals and living independently, and she was delighted to be discharged from the service.
Hi, my name is Tara Garvin and I'm a senior speech and language therapist working in the integrated care team here in Sligo. I work with the team 2 days per week and I also work on the acute frailty wards 3 days per week. My role is to support people with communication difficulties, swallowing difficulties and voice difficulties. Because I work on the acute frailty ward and in the hub here, I get to follow patients from the acute ward to home. I recently worked with a patient who presented to Sligo University Hospital with a delirium. So the source of his infection was an aspiration pneumonia, which is where food or fluid enters the lungs, and this causes an infection. Because this person presented with the delirium, they also had reduced communication ability. So on the ward, I did a communication assessment and a swallowing assessment and put recommendations in place. Some of these recommendations included reducing the language load, which means just giving the person maybe one direction at a time, ensuring that maybe the person uses non-verbal skills such as gesture, body language, and offering choices to support the person's communication. Safe swallow strategies were also put in place, so this includes things like keeping the chin to the chest to ensure that the airway is clear, and also to reduce the amount of food or drink that this person takes to improve swallow safety. So as this person's delirium was resolving, the person was discharged home with ICTOP and I got to see this patient at home as well. So myself and the occupational therapist worked together to put together a cognitive communication program. So this is to support the person's memory, language, problem solving and attention so that the person could communicate effectively within the home. So this person is at less risk of being admitted to hospital with a lower respiratory tract infection due to a reduced swallow impairment. This person is able to eat and drink safely at home once the strategies are applied, and the family are better able to support this person at home as well. The family are better able to support decision making, and this person is also better able to engage with their family and friends at home.